Всем добрый день, с вами снова эксперт Medical, и мы сегодня пришли в Academic Hospital для того, чтобы поговорить с доктором профессором Безером по поводу лечения сколиоза. Это один из самых лучших профессоров в Турции и, в принципе, в мире по лечению сколиоза как оперативному, так и корсетному. Good morning, Professor Bezer.
Good morning, Maria.
I'm happy to meet you today and to discuss scoliosis surgeries.
Okay.
Could you please tell a few words about yourself? And
I'm a scoliosis surgeon. I'm doing spine surgery at least 25 years. And I work as a professor in Marmara University Hospital, head of the spine division. And I'm also working in several special hospitals for making surgeries and seeing patients in Istanbul. And I'm also experienced in revision and deformity surgeries of the spine.
could you tell, please, if the child faces the scoliosis, what kind of treatment we can propose him?
Scoliosis can be investigated in several types. The most common type is idiopathic scoliosis. It's a mostly genetically based type. And there are other scoliosis types like congenital, which is due to failure of formation or segmentation, and neuromuscular scoliosis. These two other types are the other two common types of scoliosis. And for the treatment of choice, according to the type of scoliosis, it changes. For example, if you have a congenital scoliosis, you might need a solution when the child is small for a hemivertebral. But in idiopathic scoliosis case, the treatment is mostly given at the time of puberty. In puberty, you can have follow-up treatment for the treatment of scoliosis. And you can apply a brace treatment. We apply this treatment a lot. And you can have some kind of surgeries. Nowadays, surgery types verified from non-fusion and fusion surgeries. And they have different type of logic in the base of these surgeries.
And when we can use brace treatment when the surgery is indicated?
When we think about brace treatment is mostly indicated for patients for growing spine. For example, if you have a patient 8 years old, 9 years old, 10 years old, with a degree of more than 20 degrees, you may apply a brace treatment. Brace treatment is for the prevention of scoliosis progression, and sometimes you can even cure the scoliosis with brace treatment, and it's good for preventing surgery. That's why it's a good treatment, and we also apply exercise treatment to these patients with scoliosis when we apply a brace treatment.
And what will happen if the patient has scoliosis, but the surgery is indicated, but he doesn't do a surgery?
The surgery is indicated in patients if the scoliosis is progressive. Because if scoliosis progresses after some degrees, it will also progress in adulthood. That's why sometimes you need to have some kind of surgery. And if the progression is not stopped with surgery, it may result in restrictive thoracic ribcage movements, which may result in cor pulmonale. That means a restrictive lung and heart disease. And it's not easy to have this kind of problem because for this kind of problem, you need to have a big curve. If you have a curve more than 90 degrees of scoliosis, then you might have a pulmonary or restrictive lung and heart problem.
And how we can understand if the surgery is indicated or not?
If the scoliosis is progressive and you can't control it with brace treatment, you might have a surgery. And for example, for idiopathic scoliosis, if you have a curve magnitude of 40 degrees in thoracolumbar junction or more than 50 degrees in thoracic rib cage area, thoracic spine, then you have a surgery. And also there are some other criteria, like if you have a coronal imbalance, you might have a surgery. Or if you have a big rib hump at your back, gibus deformity at your back, you might need a surgery. And sometimes hypokyphosis, that means loss of normal kyphosis at your thoracic spine, you might also need surgery. But the most common indication is the magnitude of the curve more than 40 or more than 50 degrees in thoracolumbar junction or thoracic region, or if there is a progression of more than 5 degrees, even with brace treatment in some patients.
And what is the life after the surgery?
We do different type of surgeries. For example, in a little child, we can use some growth guidance or growth assistance systems, like Sheila system or growing growth system or Luque system, modern Luque system. These systems allow the patient to have growth of the spine and correction of the spine deformity. After puberty, you can do two other things. Fusion is a classical surgery, or non-fusion. It's a modern new surgery. It's also named as tethering surgery or correction of spine with some ropes or tether bands. And you can apply all of them. In fusion surgery, the area that you fused is not mobile. The benefit of that is it will not progress anymore and you can have a good correction with the system. In non-fusion surgery, you can also apply screws to the bodies, vertebral bodies, but these screws are attached to each other with a band, tethering band, to decrease the curve magnitude, but it's a mobile system. The advantage is it's mobile. The disadvantage is the correction is not so good, but it's mobile.
So it allows the vertebra to bend. The person can be mobile after the surgery.
Yes. Mm-hmm. In fusion surgery, you can also have vertebral mobility, but not at the sites of fusion. Mm-hmm. And in fusion surgery, if you are experienced enough, you can have the ability to make fusion as less vertebra as possible.
Mm-hmm. So what the patient should do after the surgery, how it happens, how long it takes, and what is the rehabilitation period?
Actually, in fusion or non-fusion, it doesn't matter. Mm-hmm. The day after surgery, patient stays in bed. 2 days after surgery, he'll have a dressing change and he'll be discharged from the hospital. And the only thing we ask from the patient is do not bend a lot for 3 months. Mm-hmm. And then they are allowed to bend forward or backward.
So he can do the normal exercises, come back to school, and how long he should stay
Actually,
at home?
After 15 days, he can go back to school again.
Mm-hmm. And he will not experience big pain.
At the day after surgery, they might have a pain. That's why we use some painkillers in the hospital. Then, after discharge from the hospital, we give some simple painkillers to patients. And after 15 days, most patients do not need any painkiller use.
Mm-hmm. So the pain stops completely, right?
Yes, probably.
Okay. And do the patient need some rehabilitation exercises after the surgery?
After surgery, we don't do any rehabilitation exercises, but if the patient has a neuromuscular scoliosis, the rehabilitation will progress after scoliosis surgery.
Mm-hmm. So the surgery can stop the scoliosis progression, and the patient will not require the revision or some other treatment after the surgery, right?
In early onset scoliosis, that means scoliosis which happens in young age group, for example, 3 years, 4 years, 4 years, up to 10 years of age, if you make a growth guidance surgery, like modern Luke, Sheila, or growing growths, you might need to do a revision surgery because these systems just help the spine to grow in a guided manner.
Mm-hmm.
That's why you might need a revision surgery in these cases. But after puberty, if you apply fusion surgery, there will be no revision. And in non-fusion surgeries, there might be a revision due to failure of system, due to breakage of the tethering system. But these are new surgeries, and we will inform the patient about this new technique and the complications of this new technique.
Mm-hmm. So how the patient can come to Istanbul to you for treatment?
I have a clinic in Istanbul, and I give my treatments in different hospitals in Istanbul. And for the foreign patients, they can apply to experts medical, and in experts medical they can have some guidance for their treatment. And we try to help all patients, all children with scoliosis, if they have some foundation or not. And we also give them some funds to help their surgeries.
Thank you very much, Professor Bezer. It was very nice to speak with you, and
You too.
thank you for the informative talk.